Good morning and welcome to the second webinar in our 2025 series. We hope you enjoy the webinars this year, which have been especially requested by stroke survivors themselves, and we will be having one every month for the next 7 months. And if you want to watch any of them again or look back at our catalogue of webinars, please go to our website, and if you select stroke information, it will give you a drop-down menu and you'll see the webinar library on there, and you can just click on there and watch them all again. So we would also welcome your suggestions for topics for next year, and you will have a very, very, very short questionnaire at the end of this webinar today. So if you're happy to put them in there, put them in there. If you'd like to email us, get in touch, please do. Today, I am joined by Julie, Jim, and Bridie, and we're going to be talking about anxiety after stroke. It's a very intense subject, and I think whether we all want to admit it or not, it affects us all in different ways. But just before we get into the webinar, some housekeeping. This session is being recorded, but no details of anybody are being captured, and the only people that will appear on camera are Julie, Jim, Bridie, and myself. There's a chat function down the bottom. Please chat to one another, say where you're from, where you're watching from, and everything. There is also a Q&A function. Please put any questions you have for the panel in the Q&A function, and we'll get to them at the end of the webinar. If they go in the chat function, they may get lost, hopefully in all the chat you'll be having with one another. But let's get on with the webinar. And now I'm delighted to introduce the rest of the panel to you, but I'll start off with myself. I'm Sheila. I had my stroke just under 7 years ago, and I do suffer from anxiety every now and again, which was a complete shock for me because I didn't before. I was a very sort of confident person and would just things do get out your comfort zone, but you just sort of say, right, okay, get on with it, and you take it as you come. But now anxiety can, even just nipping to the shop for something, can play on your mind, kind of thing, and you end up talking to yourself and giving yourself a talking to and what have you. But we're all affected in different ways, and it affects everybody, not just stroke survivors. We all get anxious at different times in our lives in different ways. But I think after the shock of having a stroke, anxiety can be really real, and it can take over for some people as well. So we're just going to discuss in general, why you might feel possibly anxious and everything, what you can possibly do about it. If you want to know any further information, I'll put our email address in the chat. Please email us if you want to mark it for my attention. As I said, I'm Sheila. Spell it any way you like. Don't worry about getting the spelling right. And we'll come back to you and talk about it. But please feel free that you can ask any questions you would like today, and put them in the chat. We won't put names to the questions either. So without any further ado, I'm going to pass you to Bridie now to introduce herself. Hi, Bridie.
Hi, so I'm Bridie, I'm 31 and I had my stroke in 2010, age 17. It was a cerebral venous sinus thrombosis. And I mean, anxiety has been a huge burden on me even before my stroke, and I've always been in and out of recovery since I was about 13 due to other life factors. But it definitely took hold of me post-stroke, and my mental health took control of my life, not the other way around. Mostly it was extreme health anxiety and panic attacks, sometimes where I just couldn't leave the house at all. It was just a fear of having another stroke. Whenever I had a new strange sensation anywhere on my body, or feeling dizzy, or having a headache, because my stroke, I knew at the time that something was wrong because I had a thudding headache. So when I get a headache, then it triggers everything, comes back. Yeah, even now it still brings the trauma back, but I've learned to talk myself down and reassure myself more than I was capable of at the beginning. Um, I developed a lifelong pain syndrome 4 months after my stroke, so that sent me into a spiral, having all these new feelings in my left side to get used to. And sometimes they mimic a stroke in itself, like numbness. I've got permanent numbness, no sensation, tingling, things like that. And now that kind of connects the further anxieties that arose, like the anxiety of being in a social setting and worrying how I'm perceived because I look fine from the outside, the anxiety of always having to explain myself and feeling misunderstood, and the anxiety of not being on par with my able-bodied peers. And I mean, anxiety is about the future and having this unpredictable health condition that it's hard to plan around and I can't control it. It's out of my um, yeah, and I mean, even anxiety is about the little things like money and finances, things like that. It can just build up and just feel really overwhelming. Um, and I actually also, I mean, a lot of people might not know what it is, but I struggled a lot with dissociation, mainly depersonalization, derealization, which for me it coexists with heightened anxiety, and it's been going on for a long time now. At my worst, it's been extremely hard to deal with, but now I'm very familiar with it, and once I learned it's just your brain's way of protecting itself and not something to be frightened of, it just does start to get easier that way.
Okay, thank you, Bridie. Julie, would you like to introduce
Yeah,
yourself?
so I'm Julie. I had my stroke 13 years ago, and which was apparently down to a hole in my heart. I was in hospital and rehab for 3 months, and when I left hospital, I was still confused and shocked about the whole thing. In fact, it really took about a year before I started to process it properly. The main thing I suffer from is my speech. I couldn't speak at all for about 3 weeks, and then slowly I started to talk again. And after about 3 years of seeing various speech therapists, it started to come back. But it took an awful lot of patience to get to where I am now. Awful lot. I used to be a PA to the headmaster of a large comprehensive school, which I absolutely loved. And after my stroke, I went back to work after about 9 months, and I hated it. I hated being there. I hated typing because I've only got one hand now. Well, I've got two hands, but I can only type with one hand. And I hated answering the phone. I hated absolutely everything. So, and another thing I hated was walking around the school on a walking stick in front of the children. I hated that. So, I left the school after about 3 months later, and then I hit rock bottom, and I always thought I was okay and didn't need any antidepressants. But I saw the doctor, and she listened to what I had to say. And when I started to take them, my whole life turned around. And I decided to go back to college to become a counsellor. And I tell you, it's the hardest thing ever. But I did it. And because I couldn't write, I couldn't take any notes. So I had to ask a classmate every week to email me her notes, which I found impossible to read because I her notes were her way of looking at it. So yeah, anyway, I passed eventually. And now I counsel anyone, things like depression, anxiety, etc. But also I specialize in helping stroke survivors. And that's me.
Okay, Jim, would you like to introduce yourself now?
Yes, good morning. Jim Currie. I suffered my stroke quite some time ago in 2006. So I've had plenty of practice in getting used to having my stroke and the effect that it left me with. Up until that point, I'd never been ill, like a lot of us, quite fit. I was actually in the middle of training for the New York Marathon when it happened. At the time, I was also a serving police officer. And it happened at work. And then the next thing I knew, I was in A&E, and then I found myself on a stroke ward. And luckily for me, I think I was there for it was about 10 days, and then came out. And then I started to discover how the stroke affected me, cognitively, reading, writing. I think for a lot of us as well, any comprehension, facial recognition. I also was left with a weak right side and a right side hemanopia, which means that I was partially sighted and left with permanent flashing lights in my eyes. The struggling part for me was reading and writing and coming to terms with my stroke. So I used to get very angry, very frustrated, and annoyed about how I was feeling. I used to get really anxious about going outside. I wouldn't go out on my own because I was fearing that the stroke was going to happen again because there's no predictability in it. So I had that. But also, I could see this was also affecting my family as well because when a stroke comes, it doesn't come on its own. It's a package deal and it affects everybody else. So I could see how it was happening to my family. The more that was happening, the more anxious I was getting, the more upset I was getting. And at some stage, you think to yourself, well, something's got to give. And unfortunately, I still have a very strong wife who said, come on, we need to get this sorted out. So the anxiety part really comes into it in a big way because it accumulates everything that's happened to us, whether it be paralysis, whether it's vision, our speech, all of it is connected into how we feel and how we try to get through this. And there's various ways we can do it. And for me, Different Strokes was one of the places that I got in contact with. And from then, I actually started a group in Southeast London in Bexleyheath. And that's where, things started to make a bit more sense. But before that, the nearest group was actually in Tottenham Court Road. And I couldn't go there on my own. I had to have someone to come, and my wife came because I was so afraid of going on a train. Public transport was a no-no. Just couldn't do it. And then I found people who were similar to me. And that's when I started to feel, well, I'm not alone in this. There's other people going through the same things. So from then, a bit like Julie, I went back to university and I got a master's degree in counselling. And like Julie, it wasn't easy. I had difficulty reading, writing, trying to make sense of things, trying to make sense of my own capabilities, which gave me more frustration and more anxiety, but we worked through it. Anyway, I got through it and then I started practicing. And like Julie, I have dealt with stroke survivors, but now I've decided to retire. So I no longer actually practice, but going through the course and doing things actually helped. And so here I am now. I'm now running another group. I've moved. I'm now running another group down in Whitstable, which is set up about 2.5 years ago. and that's doing well. And all I can say is that by talking to people in the same boat really helps. Thanks.
Thank you all. Well, we've got our first question in, and it kind of it's at the top of my list, this one. So I think we're just going to go straight into this question. I think anxiety can be described as a feeling of worry or uncertainty or fear. And this question resonates with me personally, actually, because this could be me writing this question as well. And it's all about fear of another stroke. So I'm going to read out the question. I suffered a major stroke over 14 years ago at the age of 29. And also since then, I've had 2 or 3 TIAs. The first stroke was explained, but the rest of my problems is in the doctor's words, great news, we can't find what happened. This left a question in my head, which grew and grew, where I now have massive OCD because this is how I deal with the daily struggles. I want to break the cycle, but can't or won't because of the fear of having another stroke. So, on one hand, yeah, I'm told it's good they can't find out what happened and there's nothing majorly glaringly wrong, but it does leave a big question in your mind. How can we get over that? Who wants to go first? Jim, since you're on screen, do you want to go first?
Yeah, okay, I can definitely go along with this. 3 months after my first one, I had a second one. Um, it was it was hard because during the first part, after the first one, I was worried. I was really scared that it was going to happen again. And I had long chats with my consultant about this. And the fact was that there's nothing they could do because at that time they couldn't work out why I had the stroke. And then I had the second one. And that really threw me. That really got to me. I was in quite a bad way then. But then they found out I'd actually had a hole in my heart, and they believed that's what caused the stroke. But yes, even after that, I was still concerned that I was going to have another one. And like a lot of us, I wouldn't go to sleep at night. I was scared to go to sleep. I didn't want to go to sleep and scared I wasn't going to wake up in the morning. So I had all this anxiety going through. And then I think at one stage I thought, by talking to other people in the groups, I thought I've got to try and get out of this. It was a spiral. And I think I've got to get out of it. And so I started setting myself little goals. But after, excuse me, after having long chats with my consultant about it, and he or she actually said, yeah, it's understandable, but somehow we have to find a way of breaking that cycle and doing things very gently and very small, setting ourselves little goals, whatever it may be, whatever something that you enjoy, you try to do it. And for me, I thought I didn't want to go out. I didn't want to go out on my own. So what I did is I gradually did little things with my wife and my kids. Well, they're growing up now. And then eventually I started to set my own goals. And one of them was just to go out and walk to the end of the road. Now, it doesn't seem a lot. It doesn't seem connected into, well, I have another one. But I'm trying to break this cycle of fear. And the fear that's controlling us, the stroke, a fear of doing anything else. So I set myself little goals, achievable goals. And then if one didn't work, it wasn't too far to fall back and then start again. I think you sit back and actually write up what it is it's holding you back, what the fear is keeping you back. I know it's the fear of the other stroke, but what else is there? Because the one thing we can't control is if we are going to have, we can't stop it. If it's going to happen, it will happen. We can try by taking the medication and doing everything else the doctors tells us, but and sometimes there is no definite answer to it. So we have to find our own. I don't know if this is making any sense because, that's where I started. And hopefully, if there's anything else you want to ask me about that and how I've moved forward with it, then I'm more than happy to find an answer or a method that I use to help me.
Thanks, Jim. It's in my case, I think if something's broken, you want to fix it. If you don't know what's broken, you can't fix it. And that's what the frustrating thing is. And I try and put it to the back of my mind, but every so often it comes forward again. And, you never get rid of it totally, I don't think, but I think you've got to sort of have that chat with yourself to sort of put it to the back of your mind and try and move on and think, well, at least it was nothing major that came up. So you just got to get on with it, I think.
I think you're right. I think one of the things is it's that part of it's controlling me. Now I want to control it. And that's where your strength comes back in, is to say, okay, you're controlling, and I don't want you to control me anymore. That was one of the things that went through my head quite a lot. It was my mantra, you're not controlling me.
Yeah.
I'm controlling you. So that's when I started to do the little things. And having that, and even to this day, I still do it. It's still in the back of my head. As you rightly said, Sheila, never goes away, but I can reduce it and put it to the back in another compartment in the back of my head and continue with my life because I want to control it, not it, me.
Definitely. I was the same as you. I didn't go out at first. I thought if I'm on my own, especially, and I have another stroke and I can't speak because I lost my speech when I had my stroke, people are going to think I'm drunk in the middle of the day or something like that. But gradually, force yourself to do it. You go out once, right? I've been out once, I can do it again. Even if you have to have a discussion with yourself before you go out again, do it and move forward with it and, try and get over it.
Yeah, I completely relate to that as well. For me, it's helped just facing the fears head on and just, once you see that nothing drastic happens once, then it gets easier, just a little bit easier. And I think you just have to work on it to the point where it's not over like all consuming and it's just a sideline instead of completely taking over your whole life. And I think as well, there's no shame in asking for help, whether that's, professionally or friends and family or even just other stroke survivors. Yeah, I think that can really help as well.
I'd say the two things is time and patience. You've got to have patience. And also what I do is I've got a grief sheet. So I take people through the grief sheet because a lot of people are grieving for their lost selves. So and I think that's half of the battle is getting over is how to not get over it, but how you can move on. Yeah, and it takes time.
And I think as well, there's pressure from other people to get over it very quickly as well, which you just can't do.
Who?
And you've got family on at you, you might have work onto you, things like that. And it's hard explaining to it. And I think that's why it's important to talk to other stroke survivors and find out that there's more people like you because, I'm sure we all felt the only younger stroke survivor when it happened until you find out there's a community of us out there.
Yeah.
And that sort of takes me on to the next comment in the questions. The question is, how do you know it's anxiety and not depression? I had my stroke 9 months ago and I just cry all the time. I'll throw that to you, Julie.
I think most people that I've met seem to cry all the time. But again, the crying does get less and less as time goes on. So again, you've got to be patient with yourself and cry as much as you want to cry, and don't feel embarrassed about it at all. So I suppose it's really horrible to think that if you might cry in front of people who don't know why you're crying, they're probably they'll be standing there thinking, why are you crying? So what? So it doesn't matter, just cry.
Mm. For me, I think anxiety and depression are alongside each other anyway. I mean, I'm not an expert, but for me, that's been the case since I've struggled with it. Um, yeah, and like Julie said, there's no shame in it to acknowledge it, and then you start to understand it. And I mean, a stroke is a huge event in your life, and it's life changing, and of course, it's going to bring out all these unfamiliar feelings and thoughts, and it's understandable that you're going to feel that way, and there's nothing to be ashamed of.
I can go along with that as well. I could see me sitting at home, and the next thing I would be crying. I'd burst into tears, and my kids would look at me if they think, well, what have we done? Have we done something wrong? Have we said something? And the fact was, no, it was just what happened. I couldn't help it. I couldn't stop it. And what I did do is I spoke to my daughter and says, why is it happening? And one thing it did make a bit of sense to me was that, in fact, he says, well, it's possibly the part of your brain that's been affected by the stroke that's causing this. And he says, and there's nothing you can really do about that because that's the part that's affected. It's affected your emotional part. And the fact that you cry is fine. It's okay. And as we said, let yourself do it
Yeah,
because
I think we forget sometimes that it is a brain injury and everything isn't
yeah,
there. It works
yeah,
all there. So yeah, I agree with
yeah.
that.
And you're absolutely right, Bridie, because we do forget sometimes. And then sometimes we look into more than what's there, which I found out over the years of working with my stroke, is that I try to look for something that's not there because maybe I'm looking for an answer.
Mm.
And actually the answer is I've had a stroke, it's affected my brain, and it's affected this part of my brain. And that's why I get so emotional. And even to this day, I get emotional. But friends and family are now aware of it, and they just say, okay, fine, and I've given up trying, making excuses because we all do. We all do it. We try to hide it. And it's the one thing we shouldn't do. But
No.
it's the one thing we do because we're human and that's what we do. We try to
Mhm.
hide our emotions and our feelings. And we don't want to show it to family and friends. And one of the things that happened to me at home was my wife said, listen, you're going to have to tell the girls what's going on in your head because they can't see it. They don't know. They think it's them and why you're getting upset. And so I did. I sat down with them and I had a chat and explained to them what was going on in my head and the fact that things will happen that I've got no control over. But it's not about them. It's the way the strokes affected me. And that helped a lot. So, yeah, have a chat with your doctor. But I would probably put it down to the fact that one is probably the effect of the stroke. And I think you will, in time, as we all say, get used to it and being open about it.
If you have people around you that can't accept it or start to try and understand, how would you suggest, I was going to say dealing with them, but getting them to understand or getting them to want to understand? Because I think sometimes people just sort of dismiss it, don't they?
First thing I would say is to contact you because you've got your different strokes have done your booklets
Hmm.
and maybe get them to read a booklet about strokes.
We've had people in the past that have contacted us, and we've gone through that scenario, and their family, friends, whoever, just won't even pick up something and read it. And that's quite upsetting, really.
Yeah.
Don't try to understand it. And I think from an employer's point of view, you have some people that have fantastic support from their employers and their work colleagues and what have you, and others that don't, that think again, well, you look fine, you don't, the classic, you don't look ill, you must be okay and everything, and won't understand it, or they think, it should correct itself quickly, and it's just
It doesn't.
no.
No.
I mean, you can't change people's perceptions of you, unfortunately. But as long as you try and not let it affect your thinking of yourself, like obviously you understand yourself better. And I mean, I think with anxiety, going back to anxiety as well, some people just think, being anxious is just being a little worried or a little nervous, but it can be debilitating. Like you're trapped and you can't get out. So, I mean, it's hard when people refuse to understand, but finding that, even if it's just a few people or a tiny circle, it's such a relief when they do take the time to really understand. I mean, for me, I don't think anyone will understand as well as I do, but yeah, you do feel at ease when people do make an effort.
And I think a big thing of it is talking to other stroke survivors, because at least
Yeah, definitely,
you
yeah.
know you're not on your own.
Mm,
Even if people around you won't understand, at
I
least you
think there's a
know.
lot of people who really do want to help you, but they don't understand what's gone through in your head. And that's the difficult part because we know what's gone through in our
Oh,
with people who are close to you, um, and explain to them. And it can hurt to sit down and explain what you're trying to explain, what's gone through your head for them to try and understand it. But if they don't have an idea, they're second guessing what you're thinking. And then sometimes that makes it worse. And then sometimes they're trying to put a plaster on something that you don't want. And sometimes it could just be that you just need a cuddle.
hmm.
And that's all. You don't want them to go out and do certain things for you, but sometimes you just want them just to give you a cuddle and say, okay, tell me about it.
yeah,
And just in small doses, just explain what's going on in your head because they can't see in, but they're trying to do their best, so they're second guessing. So sit with them and chat to them. And with children as well, when your parent, your mom or dad, or whoever you have, has had a stroke, it's difficult for them to understand what's going on. And through my sessions and counselling sessions, I've actually had young adults get in touch with me to talk about their parents and the fact that they felt that they've lost their parent, that they're no longer the same person. And I said, well, would you be able to sit and talk to your parent, your mum and dad, and tell them how you feel? And then they'll probably tell you how they're feeling. And I'm saying that again from my own experience of what I've done. It helps for us to maybe say, yeah, come on, let me tell you a little bit about it. Let me tell you how I feel and what it's like to live in my world.
yeah, and I think a little bit of reassurance goes a long way as well. Doing it that way, yeah.
Sorry, Julie, did you want to add to
Yeah,
that?
I was just going to say the only problem with that, Jim, is if you can't talk, as I couldn't, and lot of people didn't understand what was going on for me, and I couldn't actually explain to them what was going on. So that made it even worse.
I definitely agree on that. But as I say, I'm talking from people who are able to communicate. but also we now have booklets and information packs
Yeah, yes,
for dysphagia
yeah,
and stuff that's out there, which is easy to use and easy to sit down with members of your family and even young members of the family and go through it. And I think that the family packs that we do have at different strokes are great. And so we can, and again, it's a way of working around it. And I think
yes,
if as a stroke survivor, if you're working around it with a member of your family, that can only help you
yeah,
in an odd way by actually doing that, working with them. And then if you're working closely with them, you're bonding more with them. There's more of an understanding going on between you and the member of your family or other, if it's a group of you there,
yeah,
that's bringing you more together and that understanding. And that's that part of, hey, this is a big cuddle. This is what I'm giving you because you're beginning to maybe understand a little bit how I'm thinking and how I feel.
yeah.
For the person that posed the question about crying, she says, thank you, but I genuinely don't know why I'm crying. And somebody else has suggested, could the crying all the time be associated with emotional ability? It could be, but it could be something else. So that might be worth exploring. Somebody else has said, thank you for your help and listening. I can go days and weeks feeling okay. Never good, because if I said good or great, this could lead to negative outcome, which seems the normal outcome with my life. Somebody else has stated that my family and friends never listen to me. You look fine, or there's nothing wrong with you now. The best is sleep it off and you'll feel better in the morning. So that's what we were talking about, trying to make others understand. Somebody has asked you specifically, Julie, what did you find helpful for other people to do to support your mental health when you were unable to speak?
My husband actually, he was really, really good at helping me understanding what I wanted to say. So I guess that I was really lucky. I had a good husband. Um, but I guess at the time, I had extreme anxiety because it's like being a baby and having to start all over again. Um, and so I guess that I didn't actually come across anybody who didn't understand what I was trying to say because I was just at home all the time.
Mm.
So, but when I started to go out, I was able to talk a lot better. So I didn't really have that context didn't really happen to me.
So I think it'd be useful to find someone that's close to you and knows you to help
Yes,
you,
yeah, yes,
to for them to understand what you need.
yeah,
I think that goes in lots of things in life. We were talking about parents having strokes and things like that. Well, people might know their parents and be able to work out what it is they're trying to get through that they need. Then we've got someone else has asked, has anyone on the panel tried medication for anxiety and did it help?
No,
I
I
have.
haven't. I haven't specifically tried it for anxiety. But the medication I'm on for my pain syndrome is like a psychological medication, so I can't tell whether that might have helped or not, um, or whether it's just my own doing, but I'm not sure.
Jim?
No, haven't. Actually, no. I've found other ways of trying to deal with it, a lot of trial and error ways, but nothing medical.
Julie?
But
I
I do,
have, as part of my counselling training, had to do some meditation, and I found it quite good actually. But I haven't actually needed to. Again, but there's plenty of meditation out there, and mindfulness as well.
It's
in the group, I've actually had some of our members who've been on medication and have felt that it's helped them. And they were quite open about talking about it as well, which is good for other members of the group to hear, because sometimes we hear this as a stigma attached to it, to having medication. And I think that that's not the case. If it's something that's going to help you,
mm,
then why not try it? Have a chat with your doctor consultant, look at the pros and cons about it, and and if you feel it's right for you, then try it, because the stigma around this is terrible and it shouldn't be there.
Yeah,
Yeah, I agree. Yeah.
yeah, I totally agree.
and ways of dealing with it are different for everybody and how they feel about different things. One of you mentioned mindfulness a minute ago. Um, I think a lot of people can say, oh, mindfulness, no, that's not for me kind of thing. Some people give it a go with the negative thoughts in their head, then they give it a go and they find it is for them. It's more mindfulness is being aware of your body and your mind and how you feel and everything in the moment kind of thing. So it's something, you can work on. We hear quite often breathing techniques and things like that. Some people like to keep active, and this can help lift their mood and things. Um, and the good old talking about your feelings as well. But we know that not everybody likes to talk about things, and there's, I think, preconceptions about going to counselling kind of thing. So maybe you can dispel those those preconceptions of counselling, Julie and Jim.
Yeah, I think you're right. There is that thing. Is like, if I go to counseling, that means I can't cope. It means that there's a failure in me. And one of the things I say to any of the clients that come to see me, or used to come to see me, was one of the bravest things you've ever done is to walk through that door in front of someone you've never met before and want to talk to them. That that in itself takes a lot of courage. And but it also says a lot about you. It's actually saying that actually I want to take care of myself. I want to look after myself. I want help to get me to move forward. And that's pretty tough. It's tough for anyone to do it. And I can only admire the people that come, because that is a strength. It's not a weakness. And it's definitely nothing to be ashamed of. Um, so that's generally one of the things. And it is true. There's a lot of stigma behind that as well. But it's one of the strongest things you can do. And I'm sure Julie will say as well that once you come in and you start, you find that this is probably one of the best moves you've made.
Totally agree. I totally agree with you. And once they start, they tend to stay with me a long time until they start to feel better in
I've
a
had
way.
multiple therapies over the years, and it's the greatest step you'll ever take.
Yeah,
I've had CBT, I've had neuropsychology, I've been to private therapists, and it's just so helpful to get to that point where you're in tune with your body
yeah,
and you can identify your triggers and recognize when it's building up and switch your mindset. I think that's the best thing I've ever learned.
yeah,
I think one thing definitely from the counselling is what both said there is that when you go along, the counsellors will then say to you things or talk about things that you may never have thought about,
Yeah,
may never
definitely.
have thought
Hmm.
about doing. And then you try it, and it suddenly things start to change, and you think, why didn't I think of this before? But that's the power of going to see a counsellor. And they will say to you things, simple things like art or mindfulness or photography, things that you just wouldn't think about doing, and how that actually affects your mental health. And when you're involved in something, the last thing you think about is being anxious. When you get lost in something in that moment, the last thing you feel is anything anxious about how your body looks, how you feel, how people perceive you. And there's nothing nicer than being lost in that moment.
Yeah.
Definitely, yeah.
So how would people get into these things? So I mean, the first call would be going to a GP to see if there's anything the GP could refer them to. Yeah.
Yeah.
Or I'd say if they go to the GP, they'll probably get referred to for 6 months worth of CBT, which is cognitive behavioral therapy, which tends not to work so much with stroke. I think the other thing people can do is look up BACP, which is the British Association of Counsellors and Physio Psychotherapists, and especially if they want to have face-to-face counselling. That's the best place to look. But unfortunately, all counselling does cost most people, as I do concessions.
Okay. And
Sheila, BACP.
oh, have I done it the wrong way
Yes.
around? That's my Fridayness. Okay. BACP.
Yeah.
Right. Okay. It's now correct in the chat. Everybody. I do apologize. Other things that might cause stroke survivors anxiety is things like traveling on your own to different places, but a lot of assistance is available. So say you were going somewhere on a train, you can get assistance from different rail companies. If you're flying somewhere, you can get assistance from airlines and things like that. So make use of that, even for hidden disabilities as well. Just push it forward. And a lot of these things you can do online or on the phone, whichever is your preferred thing. But what you've got, I think an important thing to get in your head, if you're on the phone to someone, and especially if you're doing it online, they don't know you, you don't know them. Just say what you want to say the help you need, and you're probably never ever going to meet that person. Don't be embarrassed, just do it. And things like, visiting unfamiliar places, is the accessibility there? Have they got toilets there? It all seems, not important to other people that might not need these things, but it's very important to know where the toilets are, I have to say, and that is a real anxiety, just in general in life, never mind stroke survivors. So again, you could ring up if you were going to visit somewhere, ring them up or email them and sort of say, have you got such and such, whatever you need. And you never know, they might have some assistance available as well. But I think, don't be frightened to go to your doctor and say, you need to talk to somebody about things. I mean, even if it's, you're worrying you can't look after your family, or you were the breadwinner in your family, your relationships are going downhill. We sort of touched on that before. don't be frightened to address any issues you have and get help. And also as well for carers out there as well, you know, you have anxiety as well, you know, go to your GP and ask for some help as well. Um, you know, it's the thing is it's not uncommon. You know, people that haven't had a stroke or haven't had a serious illness or anything have anxiety too. And, you know, hopefully people will remember that, you know, everybody needs some help. Does anybody want to ask any more questions before we go? We've had another comment in the questions. Bridie, like you, someone was on medication for the pain and it still
Yes.
helps with anxiety. Someone has asked, what was that group called again? COPP. Are you talking about the counsellors? If it was the counsellors, it's BACP, and that's in the chat. They should have a website. Is that
Yes.
right, Julie?
Yeah.
So does anybody want to? Yes, they said that's what it meant. BACP.
Yeah.
And again, if you forget it or I've typed it wrong in the chat, email us. The email addresses are in the chat as well. Or if you go on the website, you'll find the email address. Just contact us afterwards. And again, if you've got any questions that that come up after you're thinking about this, or if you rewatch it, or you just want to ask, please do get in touch and we'll help you to find the answer or point you in the right direction, etc., etc. But please, if you want to fire any last minute questions in, that would be great. Julie, Jim, Bridie, if you've got anything you want to finish up with, we'll go to Julie first.
No, all I say to people is, again, got to be patient and it takes time. So, especially with that person who said they had their stroke 9 months ago, 9 months is nothing. So give it time. And I find I've found that time makes everything better.
Yeah, I agree with that. I just think don't put too much pressure on yourself and
Yeah,
just,
yeah,
just go at your own pace. And I think for me, um, just acknowledging your anxiety and facing it head on and so it's all out in the open and free to speak about. That's really built my confidence as well. Even like doing this, I wouldn't have dreamed of doing that about, 5 or 6 years ago. But the more you do it and the easier it gets and the more
yes,
confident you get. Yeah. Sometimes
yeah,
you have to make yourself uncomfortable as well. It works out for the
yeah.
best in the end.
I would just say that there's nothing wrong in asking for help.
Simple,
Yeah.
but true. And, if anyone wants to talk to any of us at different strokes or join us for any of our sessions where you talk to other stroke survivors, we've got the Facebook group. We do live sessions on Zoom and groups. There's the Befriender Hour on Instagram. There's the Befrienders if you're aged between 16 and 25. There's lots of different things we can suggest. And there's not just us doing it out there. There's other charities and organizations doing it as well. But as I say, get in touch with us if you want us to signpost you to anywhere. And good luck with it all. And we're all in this together. Don't forget that. That's the important thing. Well, thank you, Julie, Bridie, and Jim, for today. That was really good, and I'm sure you're happy to answer any questions if they come up. For those of you watching, please fill out the questionnaire at the end. I think it's only 4 questions long, so it's really short to do. and keep an eye on the website for the rest of the webinars for this year. And once again, many thanks to the panel, and hopefully we'll see you all again soon.
Thank
Thank
you.
you.
Thank you.
Thanks.
Bye.
Bye-bye. Have a
Bye.
nice weekend, everyone.
You too.
Bye.
Bye.
Bye.